The cyclone's impact has piled more woes on Malawi, which is already grappling with the deadliest cholera outbreak in its history. More than 1,600 people have died from the waterborne disease there since last year. The United Nations Children's Agency, Unicef, has warned that severe weather events such as Tropical Cyclone Freddy are likely to exacerbate the spread of waterborne diseases. The agency has been helping with relief efforts in the affected countries. Its spokesperson, Guy Taylor, joins me now live from Maputo, Mozambique, with more details. Guy, not that it's a good evening, but appreciate your time speaking to us on Africa Today. Now, I know you've witnessed all that's happened in Mozambique and certainly would have information on what's transpiring in Malawi. Just paint a picture for us, will you?
Yeah, well, I can primarily speak on the situation in Mozambique. I was in Quelimane last week when the storm hit. And was able to see firsthand the aftermath the morning after, both within the city and in the surrounding rural areas. Obviously, very shocking scenes of destruction on that first day, with many roofs torn off, many homes, schools, hospitals damaged or destroyed, and going out into the countryside, seeing quite extensive flooding and severe damage to people's homes, many of which are quite rudimentarily constructed in that area. I think now what we're particularly worried about is the ongoing effect of the flooding, and as was mentioned before, the risk of waterborne diseases such as, of course, cholera. Mozambique also facing an important cholera outbreak since September last year, with around 1,000 new cases a week at the moment. Also a risk of diseases like diarrhea, among the biggest killers of babies and children under 5. Particularly when you have lots of water standing around, and also, of course, malaria is a big concern for us at the moment.
Now, President Chakwera has appealed for aid to obviously support the many victims of Cyclone Freddy in Malawi. Now, how likely is Malawi to get the level of aid that they require or that they're asking for?
Well, again, my primary focus is on Mozambique, working for Unicef Mozambique Country Office. I think in Mozambique we're appealing for $30 million in assistance to help us to respond to the needs of women and children in this country and of families. Many people have lost everything. We're working very closely with our UN partners, with government, with civil society to ensure that people have continued access to critical basic services. Also making sure that rudimentary basic supplies are reaching children and families who need them most in the aftermath of this disaster.
Now, obviously, as UNICEF, your primary focus would be children. Now, talk to us about some of the challenges that children are facing, certainly the interventions that UNICEF is carrying out.
Yeah, well, I think one of the greatest concerns is being cut off from those basic services. So, for example, maternal newborn child health care, treatment for severe acute malnutrition. One of the risks, like I said, with this flooding is an uptick in diarrhea, which can lead to severe acute malnutrition, which can kill children very quickly. So we're very concerned about that and working hard to get those services back online. Many of the people who've lost their homes are being sheltered in temporary accommodation centres. A lot of those are actually within schools. So that obviously makes it more challenging to get children back into school. UNICEF is bringing in, or had already actually pre-positioned before the cyclone, large quantities of supplies, including, for example, large robust tents, which can be used as temporary learning spaces for children. That will help to get children back into learning more quickly, and the government has also committed to have children back in school by the end of the month. But we are facing some major challenges, and I think the humanitarian community is really quite overstretched in this country at the moment.
Now, I must hasten to ask this, is what is the general reaction to supporting African countries? I mean, it might be a generalization, if you will, but, you know, a few weeks ago, Turkey and Syria suffered great devastation as a result of those earthquakes, and the world responded pretty quickly, if you will. Does Africa get the same sort of response in times of need where disasters such as this are concerned?
Well, I think it's challenging. Just as Mozambique and indeed Malawi are facing multiple competing challenges, so is the world. And obviously, UNICEF is responding, working in 190 countries around the world and responding to many, many challenges. We have seen support for for the response to Freddy and to the cholera outbreak which we're seeing here. But I think significant additional support is really needed. As I said, the humanitarian community is overstretched. There are 2 million people in need of humanitarian support in the north of Mozambique. The country is battling a cholera epidemic. We're supporting with partners a large-scale response to polio. And this is in a country which is already has very high levels of poverty, low development indicators, so many challenges at the same time. And it's children who feel the greatest impact of this. So really additional support needed, I think.
Now, you speak, Guy, of the need for support because there are already existing challenges that you were faced with before Cyclone Freddy arrived. How then do you prioritize, or how does the aid community prioritize the needs of people in countries such as Mozambique and Malawi?
Yeah, well, I think it's a very important point, and we have to ensure that we don't lose focus on the people in greatest need. So, like I said, 2 million people in need of humanitarian support in the north of Mozambique, and often what happens, I think, with things like cyclones and natural disasters, people will focus on them for a couple of days and then attention soon shifts elsewhere. But really, what is needed here, and indeed in response to many of the other challenges being faced, is a prolonged, sustained, comprehensive and integrated response. And that requires resources, it requires attention and focus over the longer term.
Final question before we let you go, Guy. Do you feel that as UNICEF, you are doing enough to create awareness of the specific challenges that children are facing, for instance? Because there are many citizens of Malawi, certainly of Mozambique, that are across the world that potentially could be in a position to help if sufficient advocacy or advocacy at the right levels was carried out. So if they have a real picture of what's going on, are they likely to assist, do you think?
Well, I think people do want to assist, and I think we're doing everything we can to spread the message and draw attention to this crisis. And that's part of the reason why I'm speaking to you now. We're very grateful for the coverage for this crisis. I think children are often neglected in times of crisis, and it's important to recognise that it's children and families who really bear the brunt of a lot of these crises, particularly the impact of climate change. And Mozambique is really a country that's extremely vulnerable to climate change. We're seeing these repeated cyclones and tropical storms year after year. And Mozambique is a country that's really contributed very little to human-made climate change, but it's really on the receiving end. So I think there's an obligation to help, and support is needed definitely in response to this crisis at the moment.
Guy, I certainly appreciate your time and wish you all the best with the work that you're doing out in Mozambique and hopefully touching on Malawi as well. That was the UNICEF spokesperson, Guy Taylor.